Good day, everyone. Today we're going to talk about case 12 on this year about a newborn boy with respiratory distress, lethargy, and hypernatremia. So now we have to define how was the baby when he born. The patient was born at another hospital at 25 years old mother by normal spontaneous vaginal delivery after a full-term complicated gestation. During delivery, meconium was suctionated with a bulb syringe from the infant nose and mouth. The weight was 47.75 g and the head circumference was 39 centimeters and the length was 57 centimeters. Now we have a video about the babies.
Immediately after your baby is born, you'll notice your baby may be very wet and covered in some really thick creamy substance known as vernix. Newborn babies aren't washed immediately because we want them to keep their temperatures up and stay nice and warm with their mum. Your midwife will deliver the baby onto your chest. This is known as skin to skin or skin on skin. It's the best place for your baby to be because it helps your baby adapt to life outside the womb, and this also helps the baby get ready for its first feed. If you have a caesarean section, you will still be encouraged to have your baby skin on skin. The midwife will offer you an injection to help deliver the afterbirth, or the placenta as it's commonly known. The umbilical cord will be clamped and cut. You might want to consider who's going to cut the cord. Sometimes your partner will want to do this. Your baby will need to be examined. They may need a little bit of extra help just to start breathing. There should be very little time where you and your baby will need to be separated. Unless your baby is born at home, your baby will need to be uniquely identified to you. This is done with two white name bands, normally put one on an ankle and one on a wrist. Your midwife will also advise you about giving your baby vitamin K. This is an injection, very small injection, given to your baby to help prevent a bleeding disorder. You may need some stitches after the birth of your baby. This is done whilst you're still in the delivery room, still having a cuddle with your baby to distract you. Your baby will need to be checked by a paediatrician or a specially trained midwife. This newborn check is important to make sure your baby is fit and well.
Now, continue with the case. We have the treatment of the baby when he was born. So it starts with the administration of surfactant for the lungs, ampicillin and gentamicin were administered, and morphine and midazolam. Now we have another video about respiratory distress.
Welcome back. I am Dr. Manish. I am going to show you 14-year-old male child who presented with complaints of cough, cold and fever for last 7 days. Diagnosis is severe bronchopneumonia. In this patient, we will first see the case and then we will try to identify signs of respiratory distress. Have a look at chest of this child and you can see intercostal retractions quite prominent. Suprasternal retractions are also nicely visible. Now look at the face of the child to see flaring of alenazi, and the child looks severely distressed. Now let's see next case of cyanotic congenital heart disease which presented with difficulty in breathing. This 2.5-month-old male child was brought by his parents. Note subcostal retractions which are very severe in this child. Also note movement of head during respiration. I mean to say breathing. Have a look at another case of bronchopneumonia, and note severe respiratory distress in this child. Note the movement of neck while breathing.
So, on the video you saw how the baby can't breathe because he can't expand the lungs. So, returning to the case, we have to take a look about the family history. So, the prenatal testing revealed that her blood type was O, Rh positive with negative antibody screening. Her medications of the mother include iron and prenatal vitamins. She had no smoked, drunk alcohol or used illicit drugs during the pregnancy. The maternal grandmother had had a brain aneurysm, and a maternal uncle had multiple skin tumors. There was no family history of early infant or childhood deaths, autism, or macrocephaly. The medical and family history of the child's father was not known. Let's take a look at another video.
Morning, Josh. Okay. Oh, it's a dirty one. It's a dirty one. He's all registered, got his birth certificate. He's on the system.
He's got hiccups. You got hiccups. Where are you going? Lock the door. Ready. Hey.
That's a big boy. He loves Sparks. He loves him. He loves him.
Wasn't so bad though, was it?
Morning, Josh.
Well, now let's talk about the disease. We have first the respiratory distress, that is difficulty in breathing, and the psychological experience associated with such difficulty, even if there is no physiological basis for experiencing such disasters. The physical presentation of respiratory distress is generally referred to as labored breathing, while the sensation of respiratory distress is called shortness of breath or dyspnea. Now let's talk about lethargy. That is defined as a state of tiredness, weariness, fatigue, or lack of energy. It can be accompanied by depression, decreased motivation, or apathy. Lethargy can be a normal response to inadequate sleep, overextension, overworking, stress, lack of exercise, or boredom. When part of a normal response, lethargy often resolves with rest, adequate sleep, decreased stress, and good nutrition. Now let's see another video of respiratory distress.
The bronchi.
Get ready first.
Hypernatremia is an elevated sodium level in the blood. Hypernatremia is generally not caused by an excess of sodium, but rather by a relative deficit of free water in the body. For this reason, hypernatremia often coincides with dehydration. Now we have a video about hypernatremia.
Our next patient is dealing with hypernatremia. And hypernatremia is a condition where the sodium level in the blood is greater than 145 milliequivalents per liter. And we've got a lot of associated external environmental issues that can trigger this experience. And one of them is environmental heat. So sometimes these people have been in situations where they've been exposed to long periods of hot, dry weather. And my fascination for a good cactus or two is coming into play here. So we find that these individuals are weak. Very often they might be downright exhausted. And they have a classic experience of what I'm going to call cat tongue, where their tongue becomes very dry, sometimes sticky or tacky with mucus, and then becomes very rough. So not pleasant at all. No enjoyment going on. So a lot of nausea. And right along with being weak, they're going to have changes in their neurologic and neuromuscular conduction. You might have tremors. One of the things we know they get is elevated deep tendon reflexes. So think of the patellar reflex being overreactive in this case. So when you go to check that, you want to stand back so you don't get a
Boot to the head.
in terms of their cardiac functions,